This video include what is Acinetobacter baumannii infection? What are the diagnostic features of Acinetobacter baumannii? What are the preventive methods for Acinetobacter baumannii infection? Several species persist in hospital environment and cause severe life-threatening infection in immunocompromised patients. Particularly, Acinetobacter baumannii is recognized as an increasingly important opportunistic pathogen among such species. Acinetobacter baumannii have the ability to develop resistance to new antibiotics extremely rapidly. Many clinical isolates of Acinetobacter baumannii are now resistant to all conventional antimicrobial agents including carbapenems. Today in many parts of the world strains resistant to almost all available antimicrobial classes. Example, multidrug-resistant Acinetobacter baumannii have been reported. Acinetobacter baumannii is a pleomorphic aerobic gram-negative coccobacillus, similar in appearance to Haemophilus influenzae on gram stain. Commonly isolated from the hospital environment and hospitalized patients. Acinetobacter baumannii is a water organism and preferentially colonizes aquatic environments. This organism is often cultured from hospitalized patient sputum or respiratory secretions, wounds and urine. In a hospital setting, Acinetobacter commonly colonizes irrigating solution and intravenous solutions. Acinetobacter species can be transmitted to patients because of their persistence on environmental surfaces and because of colonization of the hands of healthcare workers. Acinetobacter baumannii is easily drawn in routine media such as blood agar, MacConkey agar. It looks smooth, opaque, raised, creamy colony and 1 to 2 diameter colony size in blood agar. Pale or non-lactose fermenters in MacConkey agar. Those colonies are 1 mm diameter, transparent, circular, little, shiny. Lot of single colonies you can see. Detection of Acinetobacter baumannii from traditional culture media might be a difficult task due to the abundance of background flora found in collected specimens, especially when using media based on differentiation by the lactose or non-lactose fermentation ability. To overcome these difficulties, Chrome agar Acinetobacter was designed as a highly selective medium, allowing the growth of Acinetobacter in conspicuous red colonies after overnight incubation. Biochemical test results for Acinetobacter baumannii: catalase positive, citrate positive, coagulase negative, gas negative, H2S negative, indole negative. Motility results non-motile, MR negative, nitrate reduction negative, oxidase negative, urease negative, VP negative, DNase negative. Acinetobacter baumannii infection is to control contact with patients using hand hygiene. Hand hygiene has been shown in many studies to be the most protective factor that any provider can do to prevent transmission of infectious agent to their patients. Simply running their hands under water and with a small amount of soap can vastly decrease the risk of transmission. Environmental cleansing. The next most logical and effective method is environmental cleansing, which takes the form of sterilizing surfaces and equipment. Hydrate cleaning agents such as bench can destroy the outer coating, known as the capsule, of the bacteria. However, to truly truly sterilized equipment like surgical instruments, high pressure and heat are needed.